and I'll just go ahead with the key points as outlined by Titi. So I'll start with a bit of definition, and then we'll carry on from there. I only have 10 minutes, so don't give me a thumbs up, Titi, if I'm going over my time, because I can talk about this forever and ever and ever. So I'll start with the definition of menopause. So menopause means that the menstruation pauses. Menstruation has stopped. So that is when your menstruation stops. And for you to say your menstruation has stopped, you've got to have like 12 months of not having any period at all. Menopause occurs at different times with different people, and the range is somewhere between 45 and 55. Amongst the Caucasian, the average age is about 51. Amongst Africans, I can only infer from a study that was done in South Africa, and that study shows that the average age is 48 to 49, so slightly earlier amongst us African folks. So the menopause doesn't just stop, suddenly. It gradually stops. So the time around the menopause stopping is called the perimenopause. So like the perimeter is the time before the menopause stops. For some people, it is almost a few months, and for some people, it could be years and not very nice symptoms. I will leave Pastor to talk about the symptoms later on in the talk. Some people sadly have their menopause a bit earlier. About 1% of women will have their menopause before they are 40. So any menopause occurring before age 40 is called the premature ovarian insufficiency. We used to call it premature ovarian failure, but because it connotes negativity, it's now called premature ovarian insufficiency or premature menopause. So 1% of women will have it before age 40, and about 1 in 1,000 will have it before age 30, and 1 in 10 so that we can understand what the hormone levels and things means when we talk about when we talk about replacing the hormones later on in the talk. So a woman is born with all the eggs she would ever have. So when you were about 6 months old in your mom's womb, you had about 6 million eggs. And as soon as you were born in your mom's arm, you had 1 million eggs left. That's just the way we are. Once you start your period, age 12, 13, 14, you have about 400,000 eggs left. And then every month, which is every cycle for most women, the body takes a cohort of eggs. One of them becomes the dominant egg, and that's the one that is released at ovulation, and then the rest is wasted, becomes atretic. That's just the way we are as women. Unlike with men tend to have they produce sperm till they die, really, because that's the way they are born. So, talking about the physiology next. At the beginning, the brain produces a hormone called FSH, the follicle stimulating hormone, and that goes on to the ovary. It tells the ovary that it needs to recruit the eggs. It goes there, gets a bunch of eggs. One of them becomes the dominant one. So once you have the one that is big, the ovary produces an hormone called estrogen. Estrogen is the hormone that makes you feel feminine. It's the hormone that gets the lining of the womb ready, because the reason we have this cycle is for reprocreation. So it gets the womb ready, so that the womb is ready like a nest waiting for a baby to come. Once we have the dominant follicle, and estrogen gets to a level, then it goes to the brain and says, I'm the dominant follicle for today. I don't want any other competition, so let us stop the others from growing. The brain releases the luteinizing hormone, the LH, and that one makes that big one to mature, and then it ruptures. That ovulation. So you have an LH surge. So once you have that LH surge, your FSH level is low. The other eggs, they die, and then the body, the ovary begins to produce progesterone. The progesterone then works on the lining of the womb. makes it really fluffy, waiting for the eggs to come. But when there is no egg, you shed the lining of the womb, the progesterone level goes down, and the cycle goes on and on and on again. If there is sperm, the sperm meets with the egg at the fallopian tube, and the baby it forms an embryo, and it gets implanted on day 2 to 5. So that's the cycle. So next, we'll be talking about the causes of menopause. So there are different causes of menopause. It could be natural, when the egg stops, it just stops. Or it could be what we call iatrogenic. That means we cause it, doctors cause it, and we do that for different reasons. One of them could be surgical, or it could be medical. So surgical is a woman has got cancer and she needs to remove her ovaries. So the ovaries are gone. Or a woman has got bad endometriosis, it's causing her so much pain, so much problem, and we remove the ovaries, called an oophorectomy, and that puts a woman into menopause. That is the discussion for another time. The medical causes could be if a woman, for example, has cancer and she's taking chemotherapy. Chemotherapy is quite toxic to the ovaries, and it can destroy the ovaries. Or if a woman is having radiotherapy. So those are the kind of things that would cause us to get into menopause. And then for people like that are younger, like that have premature ovarian insufficiency, they have different causes of that as well. It could be an autoimmune disease. Autoimmune means your body is fighting against your body, similar like when you have underactive thyroid or diabetes. Those are kind of autoimmune disease. You can have that in the ovaries as well. It could have infection like mumps, even very bad malaria, although they are very rare. They could lead to tuberculosis. They could lead to premature ovarian insufficiency. Genetic causes, some people have chromosomal differences like Turner syndrome, Fragile X syndrome. These are things that could cause premature ovarian insufficiency. And then treatment for cancer, like I said earlier. I think that brings me to the end of the first part of the talk.
Okay, thank you very much, Dr. Ronke, so much. I hope guys have been taking notes, and I hope we're going to see that those chat boxes blasting with questions, causes of menopause, telling us, giving us an insight into how our menstrual cycle actually works and when exactly we are in menopause. And sometimes when we say we're in menopause, we have actually passed that stage, So thank you for that. Now we're going to go to the next speaker. And by the way, we're still going to have Dr. Ronke speak at the end, because she's going to tell us about that. You remember that famous HRT? It's almost like her Royal Highness something. Anyway, but I know it's not her Royal Highness. So she's going to be talking to us about HRT. But I think it's also important for us to hear from our next speaker, who's going to be telling us more around symptoms, what to expect, those things that that we see or that we feel in us, that would also help us to understand that we're going through menopause and how to deal with it. And I have no one other than this amazing lady. I'm looking for her face. Yeah, I'm looking for her face on this. Just give me a minute. Ah, she is a beautiful lady, isn't she? She's taking her time to appear. Pastor Elizabeth Adesina-Oluwagbemiro. She's a registered staff nurse and a registered midwife. She's worked at City University, University College Hospital, London Bath Health NHS Trust, Newham General Hospital, Walsall Manor Hospital, Russell Hall Hospital, NHS Trust in Dudley, to mention a few. And she's blessed with 3 lovely children. I need not to say that she loves God, because she's a pastor. So automatically we know that we know that she loves God. So please, a very warm welcome with a wave for Pastor Elizabeth Adesina. Pastor Elizabeth, over to you, please. Can we have Pastor Elizabeth?
Good evening, everybody. Thank you very much for having me the host, Pastor Adebola and Pastor Titi. Sorry.
Oh my God, you're just giving me names.
I believe I have 10 minutes as well. Please, when is my time, just say something on the system so that I can know that it's my time to stop when it's getting close to the time. As Dr. said, Dr. Ronke, I'll just follow from her footstep. Menopause is not a death sentence, but it can, if it is not well managed, it can disturb, it can have a consequence on our daily activities. Are you having, if you are going through, if you're having you are feeling angry for no reason, things that make you, that you don't get angry at before you get angry with it, you start feeling headache, especially frontal headache, and you don't sleep, you don't have your normal sleep, you don't sleep properly, and you are putting on so much weight, you are feeling pain on your breast, you are feeling itchy for no reason. This is the onset of menopause. But before all that starts, you must, as the doctor said, be losing your period gradually. Sometimes it might come, that's from my experience, it will come, then you will stop for a few months, then it will come again. And sometimes, for me, sometimes when it's not even time to come, it will come, then I'll bleed heavily. What I'm about to say, please don't get offended. There was a time I was using baby pampers because we just come and it will be so heavy. At a point, I have to go to gynae to go and examine myself. And not after going up through all the tests and everything, I felt like when the doctor told me, even though I was a midwife, I was a nurse, he told me, oh, it's your menopause. After putting everything, and doctor would know, they have examined and everything, and they said it's menopause. I felt ashamed, so I have to go with it. And having said that, there are so many symptoms. Maybe our host will be able to show you later or give it to you to menopause that you might not know. It leads to thinning of the bone. Your bone, the woman's bone start to thin. You don't feel as strong as you used to be. It can lead to osteoarthritis. You lose your hair. You get saggy, your breast and bum get saggy. You don't feel like having sex because when you, sorry to use that, like, because you are women anyway, the vagina gets so dry. And I believe this can cause problem in family. When your husband, oh, leave me. And the man will say, and because men are always, they are ready at any time. And the man will say, maybe this woman is seeing somebody, but because they don't understand. There's something I want to say, I might not be time, but this menopause can lead to a barrage of things, like the mild depression in some people. Let me quickly explain. Because we are created to sleep. Because we don't sleep due to hot flushes and night sweating. You sweat at night, when you are sweating, you have to wake up. And when you wake up, you have to maybe do something to make you cool yourself. When you cool down, you are trying to sleep again, it comes back. And then you wake up in the morning, you have to go to work. You are tired because you didn't sleep. You can't concentrate at work. When people talk to you, you get angry and they get back at you. And you get more angry at the same time. When your children talk to you, you get angry. When your husband talks to you, you get angry. It's not you. It is because you didn't sleep. And it's because the menopause is in play, is playing up. At the same time, you have to think, what can I do? That is life changes. What can I do? First of all, diet is important. You have to change your diet. Many of us, many people during menopause like craving. You crave for sweet things, chocolate, fat, carbohydrates. Now you have to change it by all means, because if you don't, then you won't like what you get. During menopause, you have to eat a lot of vegetable, cauliflowers. Many people don't like vegetable. A lot of vegetables, fruit and vegetable. Make sure you incorporate it into your snacks. Every day, eat vegetable, eat fruits, eat beans, eat anything that is not too much fat, please. You have to eat fiber as well. Fiber is help you to move your bowels, because during menopause, you get bloated. Please, can I explain on that? Because that is what I felt a lot. During menopause, when I was going through my menopause, I got bloated, I got constipated, I couldn't go to toilet all the time. So when I go into and I bring out gases as well. So I will try my best to hold. When I'm in the church, I will sit. I don't want people to sit beside me, because I'm always moving, because my tummy is bloated. I'm bloated. I don't want to bring out gas. At the same time, I'm watching people. Are they looking at me? Are they talking about me? Because maybe if I don't have the sense of smell, maybe if I try to just sleep and say, oh my God, everybody's looking at me now. That is mental torture. You don't want to stay among people. And people don't understand. They will think. One day I was in the bus, a long time ago. I sat beside an English woman, a white person. I was trying my best to sit so that I don't, maybe I farted before I come to the bus. This man was looking at me, and I was saying, oh my God, this man is looking at me. What have I done? And then she looked at me straight in the face. I don't bite. And I was thinking, no, I'm not thinking. I didn't tell it. I was thinking to myself, I'm not thinking about you. I'm thinking about myself. All that, for people who are not strong, they're going to depression. When everybody talking about, when they think people are looking at them. And again, we need protein, because we need to build our bone, because menopause leads to thinning bone. We need to eat a lot of protein, but not fat meat, not red meat. We need to eat fish, peas, green beans, free range animal, like animals that eat grass, like goats, like hens that is free range. And when you buy your egg, buy free range. When you buy your milk, buy organic milk. And you need to drink a lot of water every day. Normally, without menopause, we need to drink water, but now you need to drink more of water, because it's very good for us. And at the same time, you need to make sure that, I know we use perfume that is not too strong, very light perfume, because if you put on too much perfume, it could irritate your body as well. But the perfume you like. And let me give you another example. These are things that can cause some people irritation in the place of work. When I told I was bloated, I started using perfume. There was a day, a woman that was pregnant. I work with pregnant women. A lot of things irritate them. She just said to me, oh, midwife, that perfume you are wearing make me feel sick. To me now, it's going to give me low self-esteem. I'm trying to make myself good, and now I'm making somebody else bad. And then maybe others have been saying it when they come out of the room, why is she wearing so much perfume? But then I feel so bad at the same time. I went home, I cried, and people, somebody saw me at home, said, why you always crying? You are just like a baby. all these things together for people that are not alcoholic can cause depression. That is why some people have depression. Another one is exercise. Exercise is very, very, very important. Exercise helps us to lose weight, and it helps us to sleep. It maybe for me at the time when I discovered, I started walking 30 minutes away from my home and 30 minutes back. That works wonder for me. Before I knew it, when I come back, I feel relaxed and I feel okay. And I have a bath and I go straight to bed. And I sleep for at least 5 hours, and which I think is okay for me. It is important as well. I don't know if for everybody. It is important for you to have an evening bath. Have a bath at night before you go to bed. We need vitamin as well. Vitamin B is very important. It is rich. It is very rich, and it has a lot of nutrients. And another one is vitamin D. We as Black people in this country, as Black people, first of all, our skin is very thick. We don't absorb enough sun into our body. And being in this country, we don't have enough sun. Even without menopause, we need vitamin D because it helps us to keep warm inside. It makes you feel warm. When you are warm, you feel okay. I mean, ward off diseases and other infections as well. So we need a lot of vitamin D in our body. If you cannot get it, you can buy the tablets. It's in the chemist. Go to chemist, buy it, and take it daily. It is important because it wears off so quickly. Another one is calcium. Because of our bone, we need calcium. We can get calcium from milk, from so many things, from milk especially. We need a lot of calcium. If you can't get it, if you can't get enough milk, enough calcium from milk, you can buy the vitamin as well. Buy the vitamin. As a woman, we need it every day. We need to take it. It's no, you don't wait till when you get so old and say, oh, but start taking it even before, as you notice that menopause is coming on. Is my time up?
It depends. Have you finished, ma? Have you?
Oh. Yeah, I'm nearly finished. Just one more. One important thing is when you're going through menopause, talk to somebody. Even though I was a midwife, I was a nurse, I don't know if I should talk to somebody because many people don't. I know at that time they're not my age. When you talk to them, they may not understand. But at the point, I have to talk to a doctor, and then we start talking together. Who's about my age, so we start talking together, and that relieves me because I didn't understand that so many symptoms of menopause there are so many symptoms of menopause at the time. So when I was able to identify it, I was able to deal with it, and thank God I felt better. And another one every day is that people will understand you. In my place of work, God gave me people that understand me. Because when I come in the morning, I put on the fan when everybody's cold. And the next 30 minutes, I turn it off. I'm always sitting by the fan. And they will say, Sister Elizabeth has come. You know, God gave me those people to understand me. So you know to pray to God as well. So I'm bringing God in because God is the Alpha and the Omega anyway. If you need to,
please don't be sorry. Just say what you want to say, Pastor. They know you're a pastor.
Sorry. So you need to pray in the morning or anytime that God, as I'm going this morning or this day or this night, bring people that will understand what I'm going through. People that will not be angry at what I do. Even when you say something, when you get angry, they say, oh, don't mind Sister Liz, it's menopause. So let us pray all the time.
Okay. Pastor Elizabeth, I'm going to have to
Finish.
ask you to pause there, yeah, because we still, and I know you've got a lot to say, and I know a lot of people have actually gained a lot. I have gained, and I've got my notes down. I'm going to be asking questions. I know someone has put their question forward, and I just want to say, please don't hold back. Yes, please put your comments in the box. I mean, someone had just emphasized what you just said around organic milk. You know, people should. Oh, can you please say, okay, we will come to that, because I thought about that as well. Yeah, so that's around why organic milk, why do you say that? But we will come to that during our question and answer session. Now, Pastor Elizabeth has spoken about lifestyle changes that we can make to get used to this menopause thing, our diet, our exercise. But there's also the famous HRT that we hear as well when it comes to menopause. And I'm just going to ask Dr. Ronke Awe to come on board again and tell us a little bit about this HR, because we've heard a lot about, I don't know much, I've read, but you know, it seems to be like a thing that you shouldn't go near, if you understand what I'm saying. So please, we'd like for you to demystify that for us this evening. So over to you, Dr. Ronke.
I was trying to use sign language there. Right, so now we're going to talk about the HRT. And I'll start by saying that a lot of us Africans don't like using HRT. We just want to just rough it. I spent time talking about the physiology so that you will understand the hormone pattern. So we have FSH, we have LH, we have estrogen, we have progesterone, and all of these help us to have the cycle that we are having. So HRT is hormone replacement therapy. So when our body stops producing the hormone, we are putting back the hormone. Either in different ways of using it, there are different ways of using it. Different people need different HRT. Pastor Elizabeth sorry, I'm trying to put my timer on here. Pastor Elizabeth has spoken about different symptoms and things that people have, that people worry about. So for example, somebody that has vaginal dryness, I'm sorry, I'm a gynecologist and I talk about vagina and things like that. So if you're not used to hearing such things, apologies, but being a gynecologist, that's one of my lingua, sorry. So the vagina is dry, you find sex difficult. For that kind of person needs a vaginal estrogen that you can apply, in the vagina, like a cream in the vagina, and that's just local. For some people, they have reduced libido, and all they need is to use testosterone. So these are things that are specific for people with, depending on their specific need. So we start with the HRT. So with HRT as estrogen and progesterone. For some people have had hysterectomy, so they have no womb. For such people, all they need is estrogen only HRT. The reason we have estrogen and progesterone is, if you don't have progesterone, it does not protect the lining of the womb. And if you have a womb, that's the uterus, and you are using estrogen only, you can end up having endometrial hyperplasia and endometrial cancer. So that's why you need the combined one. And then the HRT can either be sequential or continuous. Sequential is like a pill, it's cyclical. So you have some tablets that will be estrogen only, and then tablet that will be progesterone only. And that one, with the cyclical one, you're likely to still have a period, so you bleed. So usually people that have premature ovarian insufficiency want to have a period because they are young, and their colleagues will be wondering, why don't you have a period? People start being nosy and want to know what's happening in their life. But for those kind of people, or people that are still in the perimenopause, not quite into, not stopped having a period, they might want to use a sequential, a combined HRT. And the continuous one is in the tablet. It's got both progesterone and estrogen, and you don't usually have a period when you're on the continuous HRT. HRT could be in tablets, it could be in patches, it could be in gel, it could be mixed. You could have, so it's something you need to talk to about your with your GP. So what I'm trying to say is I want to make you realize that it's just a tablet. It's like you have vitamin D insufficiency and you're taking vitamin D tablets. It's like you want extra vitamin C. This is a hormone, yeah? So I want us to realize it's not much of a big deal. It's just replacing the hormones that we do not have. And there are different ways you can do it. Some people will have the tablet and it just does not suit them. So they can have a Mirena coil because the Mirena has got progesterone in it. And that could be all that they need with a tablet of estrogen. So they mix and match, and your GP is able to sort you out with something that works best for you. For some people, it's just the patches. So go to your GP, talk to your GP, and you can do what's best for you. You don't have to suffer. It's about quality of life. It's about knowing that these things are there. You don't want to have. I saw a WhatsApp video of a guy who had a wheelbarrow, and he had it was lifting. Instead of pushing the wheelbarrow, he put his stuff in the wheelbarrow and lifted the wheelbarrow like a bucket, because he didn't want to push the wheelbarrow. So when we have these things, let's use it. So every medication, even paracetamol, has got side effects. There are side effects like breast tenderness, headaches, vomiting, nausea, vaginal bleeding. And then the thing that fears a lot of women or a lot of people is the risk associated with HRT, particularly risk of blood clots, risk of breast cancer, risk of stroke, and risk of heart disease. So those are the things that make a lot of people worry and not want to have HRT. And then HRT is not for everybody. So if a woman does not have a period, one of the most common causes of not having a period is pregnancy. So the first thing the doctor asks you to do is to do a pregnancy test to make sure that you are not pregnant. And yes, you can be pregnant age 50, because if you are still ovulating, you can get pregnant. If you're having abnormal vaginal bleeding, before your GP starts you on HRT, your GP wants to make sure that you don't have any cancer or anything worrying that the HRT will make worse or the HRT will hide. If they are thinking of womb cancer, for example, if you've had blood clots or heart attack, they're worried about those. If you're having liver problems, because most of those medications we need to go through the liver to be metabolized, to be broken down. So if you have liver problems, they will not give it to you. Or if you have what is called porphyria cutanea attire, which is like skin blistering problems, that could be an issue. Right. So the next slide is a very important, a very nice slide I want us to look at now. Is putting HRT in perspective. So one of the things that people worry about 10 years ago, you've gone past it. Titi, could you go back to the next slide, please? Yeah. So one of the things that people worry about a lot is this risk of breast cancer. And they're like, oh, you're going to have breast cancer. You're going to have breast cancer with HRT. There was this study that was done a few years ago now, and they was no, everybody should stop using HRT. HRT is bad. It's bad for you. It's going to kill you as a woman. But if you look, using the UK general population, we have 23 cases of breast cancer. That's the background risk of breast cancer for somebody that has no risk at all. Anybody just being a woman, you get 23 breast cancer diagnosed in every 1,000 women in the UK population. So if you use combined hormone HRT, you have 4 extra, yeah? And that's what people saw and people were worrying about. If you use the estrogen only, you get 4 less. So it actually protects you. The estrogen only protects you from breast cancer. But now think about this. A lot of people use the contraceptive pill. If you use the contraceptive pill, it's the same risk you get when you use the HRT. And if you drink alcohol and you drink like 2 units of alcohol a day, which is just nothing really, then your risk is even more drinking alcohol than using HRT, you get 5. You have 5 out of 1,000. Sorry, you get 5 more. Sorry, not 5 out of 1,000. You get 5 more people than the background of 23. If you smoke, if you're overweight, that's a very classic one. People that are overweight, if you don't exercise, and if you exercise, it saves you. So just we have to put these things in perspective, and that's what this slide is all about, which I've also explained in the second slide, that if you drink alcohol, you have about 1.5 times more risk of developing breast cancer. Finally, I also talk about the WHI, in case some of you have read about the WHI initiative. So they are the Women Health Initiative. They did a large study over 10 years ago now, and then that's when everybody stopped using HRT, really, because everybody was scared that, oh, I'm going to die from using HRT. But now people are realizing that even when it comes to blood clots, there are things you can do. We can change things. For example, instead of giving you the tablets, because the tablet gives you the risk of blood clots, we can use the Mirena coil, or we can use the patches. So there are things that people are doing and they are changing now. If, for example, the risk of stroke, if you use your HRT before age 60, which is when most people need it, it does not increase your risk of stroke. So people have gone into those studies, they are checking them again, analyzing them again, and seeing that, yes, HRT, like a lot of other medication, have got risk. And like some of my patients will say, I would rather live to be 75 and die at 75 than live to be 85 and have a horrible life. Some people will keep using it even past age 60, that most doctors will recommend it for. So I think we're nearly at the end now. There is no risk when you have patches, for example, or gels. You don't have all those risks of blood clots that people worry about. And it's about managing it properly, seeing your GP, and having it done for yourself. The good thing about HRT is it gives us the estrogen. If you don't have estrogen, you see a lot of people that are old, they get fractured because they have osteoporosis, and their bones get very thin and it can break easily. Estrogen also helps you with your heart. If you have low levels of estrogen, you can have heart attack and cardiovascular problems. So overall, HRT could be your friend. If you're HRT, not HLT. HRT is hormone replacement therapy. So we can use HRT. It is your friend. It is not your enemy, and you can use it. So I think at this point I shall stop.
Yeah, thank you very much, Dr. Ronke. Over to you, Adebola.
Okay. Oh, wasn't that interesting, ladies? I actually thought I was the only one that when I'm sitting down, I'm kind of making sure that my bum is well in the chair so that when the gas comes out, it doesn't make a noise. I actually didn't know that, Pastor Elizabeth, so God has forgiven me. The pastor can be doing that. So anyway, that was really informative. Thank you so much, Dr. Ronke. Thank you for enlightening us on this and giving us so much to think about today. So we're going to go to questions. I'm going to take one of the questions, and if you do have more questions, keep typing them in. We're going to make sure that we cover all of them. And I'm going to take the first question is from a sister yesterday, Owoyemi, and she says, you've touched on diet, but I found out that no matter what I eat or how small, I'm still putting on weight. Welcome to the club, sis. What else can I do apart from exercise? Is soya milk better than cow milk? So there are 3 questions there. 1, no matter what I eat, I still putting on weight. What can I do apart from exercise? And also, is soya milk better than cow milk? I don't know. Is Pastor Elizabeth willing to take that? And then Dr. Ronke can add to it as well. Would you go like that? Is that good? Yeah. So should we hear from Pastor Elizabeth first, and then Dr. Ronke on that? And then the next question will be you, T.
Thank you, Sometimes genetic factor can come to play. Depends on your family. If most of your family are a little bit plumpy, maybe your mother, your first degree relatives, your mother, your father, sometimes it might be difficult to lose weight. And sometimes some people is not putting on weight, they have big bones. Because I always, when I was younger, I go to the doctor, I say, oh, look at me, I'm fat, I'm this. You say, no, you got big bone. Apart from that, if you don't eat the proper food sometime, no matter how little it is, you will still put on weight. You would need a lot of vegetable. Spinach, especially for me, is very good. And you need to try to move your bowels at least. I mean, every day is better, but because then it will not, it will not retain it. And when you eat certain food, sugary food, a lot of carbohydrate, no matter how, if we turn again to sugar, we turn to starch, it's a sugar, then we will retain it, we will turn to fat again. So that's another thing. And another thing is your metabolism needs to be working very well. I don't know how to explain this. Metabolism is what breaks down the food into everything, we know what metabolism, you need to work very well. So apart from exercise, you need water, vegetable, fruits, a lot. But keep on doing the exercise. It depends on the exercise. It's not like going to gym or going to anything. You can, in your house, you can walk. So these days, because of the lockdown, sometimes I walk from the kitchen to the front door. I walk 30 times. That is my exercise. Sometimes I will dance. I will just stand on the telly, watching the telly. When there's music, I'll start dancing to the music. If anybody sees me, I'm sure they'll say, "What is this one doing? I'm dancing." It's not that I've done that. It's exercise. Although I dance to Christian music, but it's exercise. But you have to look for a way that works for you with exercise. As well, you need to have enough sleep, because if you don't have enough sleep and you are exercising, you get tired. When you do maybe 10 minutes, you say, oh, I'm too tired. You need to have a regimented exercise that is good for you. That's all I can think about.
Thank you, Pastor Elizabeth. Now I'm going to take this other question. I like this one because something that I've experienced myself. The question is about, and this is, I'd like Dr. Aderonke to answer this one. It's about, says, what do you do if you have 2 menstrual cycles in a month? There's another one around, still a question around 2 menstrual cycles a month and weight gain despite controlled diet. There's another one that says, so what do we do if symptoms persist for a long time after the flow has stopped? So it's still around the cycle, happening more than 2 menstrual cycles in a month. How do we cope with that? And even when the flow takes longer than before, what do we do? And if after doing all this jump up and down exercise, I dance to Azonto, I dance to praise God, whatever, I walk, jump up and down, I'll count my steps, I'm doing 7,000 steps a day, and I'm still not losing weight. What can we do? What should we be worried? Is it something that is just the norm? Dr. Aderonke.
Okay,
before Dr. Aderonke answers that question, sorry, Titi. Dr. Aderonke, I'm not sure, maybe you're going to answer the one about the milk, because the question that I asked,
I can add that to.
Okay. Yeah, and then also someone was asking if almond, I think Pastor Elizabeth mentioned organic milk, why that is better. And also someone asked if almond milk. So let's put all the milks together.
Okay.
So answer that together as well with that.
Okay, I must start by saying I'm a gynecologist and not a dietitian, but I'll try my best.
And it's a discussion forum. So if there's a dietitian on board, please, if you have the answer to that question, feel free to put it in the chat. We're here to, educate ourselves. So you can also contribute as well.
Okay. So I'll start with the 2 cycles. 2 cycles could be normal. For example, if you have a 28-day cycle or a 26-day cycle, and you have a first period on the 1st of November, for example, and then you have a period on the 30th of November, that's 2 cycles in the month, but it's normal because it's still the 26-day cycle. So that on its own is fine. But if you're having shorter cycle, and it could be you have a period now, and then 2 weeks later you have another period, then that usually is not normal. It could be a cause, it could be various, it's caused by various things. And I think this is not the right forum, because I can talk for another hour about this. You could have a polyp, and if you have a polyp, you have things called intermenstrual bleeding. So you're not really having a period, you're just having another bleeding in between your bleeding. You understand? It could be because you are perimenopausal, and because you're perimenopausal, your cycle is going different ways. FSH is high today, it's low tomorrow. So, and your brain is just like scattered, it's just sending the impulse. And once it sends the impulse, and it's quick enough, and you have enough progesterone, you bleed. Can you hear me now?
Yes, we can hear you.
All right, yeah. I don't know what was the last thing I said that you heard, but it could be caused by different things. And menstruation and menstrual dysfunction is a topic for another time. It could be natural because it's just you counting it as twice a month, but it's actually one at the beginning of the month, one at the end of the month, normal cycle. It could be because you're having intermenstrual bleeding, which is not normal. It could be because you have something like a fibroid or polyp, or something in the lining of the womb that is causing you to bleed irregularly. It could even be a sign of endometrial cancer, depending on your age. But for the purpose of this talk, because we are talking about the menopause, I could say it's because you're within the perimenopausal period, and your brain is just sending different signals. At times it won't come for 3 months, at times it comes twice in the month. That could be the cause. So if you're having a problem, I think see your GP, discuss with your GP. Your GP will probably organize for you to have a scan, ultrasound scan, make sure that there is nothing to worry about. It will examine you. If you see a gynecologist, they might take a pipelle biopsy, which is a sample of the lining of the womb, to make sure that there is no cancer. But overall, it could also be dysfunctional uterine bleeding. It's just bleeding because the hormones are not in sync, and they could put you on the contraceptive pill for a little while to make it get back to sync. That's for the cycle. And then there was the question on flow, that after the flow stops, you still have symptoms. There's something also called premenstrual tension or premenstrual syndrome, and that's not a topic for today as well. It's just your hormones. We as women, God has made us special. We're full of hormones, and at times we feel we're young. I don't know the age range of people here, but some people are still young. They're not in the menopause area, and their hormones is just all over the place. And there are lots of hormonal treatments that you could be giving. We could also have things like CBT, which is just like cognitive behavioral therapy. Like just talk to somebody and they just help you through the journey until you're able to be in control of yourself again. So yeah, that's for the symptoms. So if you see your GP, you can just put you on the pills or give you some medication. That time they want to give us things that are like antidepressants. It's not for depression, but those antidepressants will work to help you with your moods and the hormonal imbalance that the mood changes that is caused by your hormonal imbalance. Exercise. I think it's for all of us. As we get older, I used to be skinnier than I am now, and my auntie saw me and said, excuse my language, she said it in Yoruba, she said, Aderonke, I felt really embarrassed, like, oh, because I'm like, oh, but she was good for me because it was my challenge. I realized that I was getting bigger and I had to make sure I stayed thin and fit for my husband. Because before we got married, he told me that Ronke, you must not have a big tummy. I don't like women with a big tummy. So I said that is, so that's our prenuptials signing with me and my husband. Although he's got a big tummy now, and he tells me that we didn't sign for him not to have a big tummy. So I think it was my fault. But back to it, I understand where you're coming from. And the older we get, usually the comfortable we become. We become the mummies in the house. We have people to run around to do our work for us. At work, we become consultants, we become managers, we become senior. We don't run around again. We become very comfortable. We don't run for the tube. We drive around. We don't run for the train. So we don't burn as much energy as we used to burn. I'm talking about myself because I know that the older I got, the more senior I got in my career, the easier work was for me. When I was running around on the labor ward, I was the one in charge, running around making sure everybody was okay. When I became a consultant, you give instructions to people. People are learning. You're training people. So you're not the one really running the shop. You're just strategy. It's just brain energy. So I realized that I couldn't just be as lax as I used to be. When my pastor will understand where I'm coming from. On the labor ward, we always have people give us chocolates as thank yous once they have the baby. They're always happy. There's always chocolate on the labor ward. They don't give us fruits, they give us chocolate. So you see all of us getting round. So we have to be intentional. We have to realize that, okay, I've had one chocolate today. I have to stop. We have to realize that we don't run around, we don't burn the energy. If we are very true to ourselves, we realize that it's easier. I mean, we do try. We have good days and bad days. And there's some days you're like, you know what, I just can't be bothered. There's so much chocolate. I'm tired. I can't go and have a proper meal. So I've got to eat whatever is in front of me. So we've got to be intentional. We've got to watch what goes in. The way we put on weight is when there has to be a balance. When you are putting in more than you are burning, you're going to put on weight. There's no way about it. When you are older, your body's metabolism is slower, so it doesn't burn as quickly. I used to eat less. I know that I've started eating a bit less than I used to now because I realized that if I ate what I ate before, I'm just getting fatter. You don't even have to do big, you don't have to go to the gym. Go on walks, brisk walks. If you swim, go swimming, but do something about it and you would lose some weight. But it has to do with our hormones changing. It has to do with us getting less active as well. So we just have to be intentional, cut down on the intake and increase on the burning of the food. That way you're going to lose weight. You'll be in negative balance. And then finally about the milks. I think soya milk, almond milk, cow milk, they're all milk. One of them is vegetable. So definitely vegetable is always healthier than animal fat. So I think on that instance, I would say soy milk, almond milk is better. But for me, as women and as human beings, God has not made us all the same. So what suits me may not suit you. So you have to discover, go on your own journey. You have to make sure you cut off on, it's a try and error each time. You see, does this make me feel better? Am I okay with this? One of my very close senior friends, when I was in Plymouth, she wrote a book. And I think it's a very good book for you guys to read. It's called Dear Toriola, Let's Talk About the Perimenopause. She is an educationist. So she wrote about her journey, about how she went through the menopause, the things she tried. She tried things like honey, soybeans, all these things that, all these alternative things. She tried them and she's written them in her book. And I read the book and I did a forward to the book. I think it's a really good book for people to read. There are also things like the British Menopause Society is a good one. They have lots of resources that we can tap into. There's Menopause Matters. There are lots of things there that we can tap into. And like we said at the beginning of this talk, menopause is here to come. It's going to come. In a matter of time, it will come. My husband, I've been having night sweats. On the day I woke up, like four years ago, it was even winter, and the whole bed was soaked. My husband was like, what happened? And I think initially I didn't know what it was, but as it starts occurring more and more, I realized that this is just me having night sweats. And that's it. Once you clock 40 and you're getting towards 50, you know that it's coming. And as I'm going closer to 50 now, I know it's coming, and I'm waiting for it. And knowledge is power. Knowledge empowers you. You know what to expect when you have your mood swing. I'm glad that there are guys on this call, because you understand when your wife says, I'm not feeling like it today. You know it's not because she doesn't want it. You know it's because of the changes, and you're there to support it. Let's get our husbands, our partners, let's get them on board with us. Let's educate them. Let's educate ourselves and make sure we help each other to enjoy the next season of our life that God has given us.
Okay, thank you so much, doctor, for that. Just want to ask one question as well, one for you, and the one for you is about someone asked if they're with bone thinning, would you recommend running? So maybe you could quickly answer that. Then for Pastor Elizabeth, some of us don't like cold or warm food. We like our food, but I notice I sweat a lot as I eat since this I believe is menopause. So the food that we eat, which is like amala, unkobi, pepper soup, all the food, lots food as well. Lovely. So Pastor Elizabeth, you would answer that question after Dr. Ronke. Thank you.
Okay, so when it comes with the bone thinning, it's over time. When we have our periods and we have estrogen, the estrogen actually stores in our bone bank. So if you have a bank, you're storing for the future, so that you don't have osteoporosis. So if you already have osteoporosis, I wouldn't say you should run, because if you're running, it won't make it stronger. Running will not make your bones stronger. You don't want high impact exercise, because you're going to fracture, you're going to break it. So, but if you're talking about running, it's not for bone thinning. It's for things like maybe muscle mass, because as we get older as well, our muscle mass thins. So exercise will help you build on your muscle mass, not for the muscle thinning. For the muscle thinning, not for the bone thinning. For the bone thinning, things like your calcium, your HRT actually would help if your bones are thinning, particularly for those who have who get into premature menopause. You definitely need to be on HRT or some sort of anything that will give you estrogen, because that's going to help to prevent you having the fracture in the future.
Okay. Is it my turn now?
Yes.
Okay. Thank you. Before I go to that, I want to say something about, I forgot to say something about craving. During menopause, it's like pregnancy as well. A lot of women crave for certain things. It could be, maybe you usually, with me, because in labor ward, we always have a lot of chocolate, as Pastor said, but I'm always looking for one is Snickers. Because of the peanuts, that I'll take Snickers and eat it. But then those little things that we eat, maybe if I announce a midwife, or maybe your place of work, they take food round. Like yesterday at work, they bought loads of donuts. They brought it to us because we can't go out to buy food. So I just said, no, thank you. Every time I go there, I'll just move my face. We need to have some, be able to say no to those little things, because they add weight. So talking about eating, as Pastor said, eating a lot of things, you can still eat your amala, ngobi, but make sure the carbohydrate is very small. I mean, there's a food plate. Maybe if you Google it, you look for the food plate. The food that is good, that you can, the proportion of food that you can eat. But make sure you have a lot of vegetable in it. Okra is good as well. A lot of vegetable in it. And limit your meat intake, fresh meat intake. Eat fish. And when you want to eat meat as well, make sure you buy free range. What I mean by free range is the same thing with organic milk. The free range animals, they are not caged. They are able to go out and eat grass and eat green things, which is good for them. Unlike processed food that is fed to the one in the cage. Maybe the food they have added all sorts of things to. Free range organic is when they have gone out and eat a lot of fresh green vegetables, which in turn has some vitamin and other things in that animal. So let us try as much as possible to eat free-range animal. And fish is very good as well. Organic milk is from organic cow or goat. So it's more profitable to our own body than the cage animals. Does that answer the question, please? Does that answer the question, Pastor?
Yeah, I believe so. Thank you very much, Pastor. I've got a few more here. Firstly, I'd just like to, we said earlier on that we are all here to share knowledge. And if you're an expert somewhere, you've got suggestion, please put your comments across. And somebody has said, regards to sex, poor, low libido, she said, don't be shy to add lubricants. So ladies, are you listening? Don't be shy to add lubricants, water-based, in your repertoire to help with sex. Yeah, there's no shyness in that. If you're experiencing dryness, and most importantly, involve your partner. Let your partner know that, this sweaty, this menopause thing, this is going to happen. So this is the way we're going to go. Are you okay? Shall we, come together with a plan forward in terms of your sex life? There's also another question here around the tenderness of the breast. And she said, this person is asking that, sorry, let me see now. Asking, does menopause affect the texture of your breast? I think they're asking about maybe the fullness of your breast. So this will be a question for Dr. Aderonke Awe to answer, please.
It does. It does affect the texture of the breast. At times we start to get the sag. Like we say, it goes southwards. And it goes southwards. So you shouldn't have lumps, though. If you do have lumps, see your GP to refer you for investigation. But it does affect the texture of our breast.
Okay. And then there's another one still about sex and how we're walking this journey with our husbands. And she said that, she sweats a lot at night as well, and then the hubby sweats as well. So two people sweating can be a bit much. And it says that is that part. I tinkle a lot at night, which affects my sleep. Is that part of menopause symptoms as well? Yeah, would you be able? Is that part of it? I'm not sure. Dr. Awe, if you could answer that as well.
I think the tickle would be does that mean a little bit of wetting the bed a little bit? Is that what it means? I think.
Could the person please please, if you'd like to speak, let us know. It doesn't mean we can speak. If you'd like to actually speak directly, just put a message in the box for us. So that question, doctor is asking, is it I know as we get it, and it's another topic for another day where, bladder and all that. Yeah. So that one. Okay, yeah, I pee a lot. Yeah. I pee a lot.
Yeah, we do. We have a bit of incontinence. We have a bit of more waking up at night, which is normal. So at this, when you're like less than 40, you might sleep through the night without needing to wee. But as you start getting towards 50, you can be waking up once or twice at night. As you get older, the number increases. So that's all part of growing up and our bladder getting less, losing the strength that it used to have. So that's all part of, not necessarily menopause, but part of us getting older. And some people get more urinary infection. That's part of menopause. They get, because it's dry, they get water infection a lot more.
Thank you. Adebola, is there anything you would like to say as well?
I certainly just want to say that, this has been an awesome, awesome evening. But I know that any lady that is out there that wants to say anything on diet, because I know that I don't want to put anyone on the spot, but I know we have a few. I know someone in the midst of us that is a diet expert and can talk a little bit about food and what to eat, because I think Dr. Runke was very precise when she said that different things work for different people. And I've noticed that what I could eat 10 years ago and I could get away with, I couldn't even look at it. I'll just put on weight, just mere looking at it. I don't even have to eat it. I could just look at it and I'll put on weight already. So there are things that we need to change in terms of, and then Pastor Elizabeth was talking about metabolism. What would work well for our metabolism? I don't know. I'm just putting it out there. Is there anyone that wants to share a little bit for us? I don't want to put anyone on the spot, but I know that we have someone in our midst that could share some insights into that. But just putting it out there, wanting people to volunteer, just put your hand up. You could use some of the reactions and just let us know, and then, we'll unmute you. Thank you.
I just want to say, and thank you everyone that's been sharing their they've been making their contributions. Thank you, Dr. Ronke. I think you've put a website there, a book, Dear Toriola. Let's talk about perimenopause. Oh God, that's
perimenopause. Sorry, that's a typo.
Okay, perimenopause. Okay, a very good resource on Amazon, so we can go there to help ourselves have a good read. British Menopause Society is a good site to go to. Menopause Matters is another website to go to read more about menopause matters. Daisy Network. That's another, I believe, another website that we could go to educate ourselves. Someone has also recommended a product. Like I said, we should know we understand our bodies. So, but someone here says Replens is a good product. I believe.
Can I add another one? Replens is good. Silk is good. Okay. And there's a new one called Yes. It's just called Yes. And it's beautiful because it's natural. For those that are very into organic things, it's good.
There you go. Yes. I think I won't forget that. Yes. Okay, now we've looked in, and in the absence of, I've had an amazing time tonight. I know you guys, you've had an informative time as well. But before we round up, I just want a word from our speaker. So I'm going to go to Pastor Elizabeth. Just in a nutshell, what is your advice, menopause? Moving on, what would you like us to take away in a nutshell?
Okay, my advice is talk to people, first of all. Know what is going on in your body. Talk to people that you can confide in. And do what is good for you. Know what is good for you, because we are different. And besides, one person don't get all the symptoms. You get few. So if you feel you are going through this, discuss with somebody who has been there before, who knows. You may be able to know better. And then try to reduce your fat and carbohydrates and do some exercise.
And thank you very much. Dr. Ronke.
Well, I think Pastor said it all. You need to know yourself. We need to see it as something that is definitely going to happen. We're educating ourselves at what we're doing here, and look forward to it and enjoy it when it comes. It's another season in our life. Let's enjoy it. And I pray about everything. Pray. And I tell myself, I tell my body, I said, you know what? Your perimenopausal is going to be itch-free. I keep declaring into my future. I said, no problem. I will just realize I wake up one day and the period is gone. No problem. I'm telling myself I'm not going to have this, because I know in advance, so I can pray and declare God's words in advance. And so far, so good. It's doing well. I'm looking forward to my menopause. I know God honors my prayers, and it's going to happen. This is really on the spiritual aspect. And on the physical part, putting on my cap as a doctor, if you have symptoms, there is no fear, there is no shame. Africans women, we try to struggle. That's why if you look at this is a bit going out of the going out now. African women, we are 5 times more likely to die in childbirth than the British woman. And the Asians, they are 2 times likely to die. Why? Because we suffer in silence. Let's change the narrative. If God has given the doctors the wisdom to do these things, if you need it, please go and ask for help. Not all doctors even know everything about menopause. So make sure you look for a doctor with a specialism, that understands menopause and can help you.
All right. Thank you so much, Doctor. Thank you so much. And thank you to Pastor Elizabeth as well. Just obviously stating something that, that I think that we all need to be aware of is that, like what Dr. Ronke said, menopause is a transition. I mean, we've all grown up, we've become teenagers. Remember the times of, pedal pushers and, wearing mini skirts. We've gone through that transition. We become adults. When we were growing up, we wanted to grow up fast. And I used to put clothes in my bra to make my breast look bigger. And then we've grown up and we've gone through those stages, and now we're going into another transition, and the transition now is menopause. It's a big M. So, and I think I just want to leave you ladies with this tonight. If you look around you and you look at great women out there, you look at someone like Michelle Obama, she's gone through menopause, or she's going through it at the moment. You even look at the current president, Kamala Harris, she's probably going through it at the moment. So women are reinventing themselves. Let's reinvent us. Let menopause time be the time that you rediscover yourself, discover be the old girl, go out there, do something, be creative with your life and get something accomplished. This is the time to write those books. This is the time to do those podcasts. This is the time to start even a new course, anything, just reinvent yourself. And someone said in the chat about coffee. I actually like coffee. I take coffee every morning. And I think coffee works for me because it actually makes me go to the toilet. But some people, obviously someone said coffee is not good. Caffeine is not good at this time. Doctor is shaking her head. But it works for me. I think you really have to know what works for you, don't you? So, but then they said less caffeine, less alcohol will help you manage the hot flushes. And someone was saying, in terms of a little bit of a tickle, do some pelvic exercises. I remember doing that when I had my children. I remember there was a lot of pelvic exercise when you're peeing and you hold and you count up to 10. I don't know, maybe anyone ever does that. I think they say that helps. Yeah. and someone was saying wear absorption pads, where obviously the tenor pants, I have to say, like Pastor Elizabeth, I used to have a time when I used to have big gush of blood and I used to wear that and no one noticed. So do what's comfortable for you. Just embrace it, enjoy it. It's a transition, it's not a disease. Go girls, go ladies, let's reinvent ourselves. Good night, everyone, but Titi is going to talk now.
All right, thank you, Adebola. Thank you, Pastor Elizabeth. Thank you, Dr. Aderonke, and everyone on call. I can't say enough. Without you, we wouldn't have a session. We can't be talking to ourselves. So thank you for taking your time to come and listen to us. And thank you, guest speakers, for sharing your knowledge with everyone. I am embracing menopause. When I have those hot flushes, when it first started, I didn't get it. I've heard about it, but when it actually happened, I thought, oh, what just happened? And then I thought, you know what? I'm not just going to be depressed or just start feeling bad about it. If I'm hot, I switch on the fan, I have my sleep, I have my bath. This waist that is enlarging, that's my problem, and I think exercise will solve it. Is not, I'm on a mission. I'm on a mission to cut that waistline down, and I hope I will get there. So thank you, ladies and men online tonight. Yeah. Okay. One more word.
One very quick tip. I want to encourage us ladies, we can do this. Don't buy the next size up. When my auntie told me that I'm getting bigger, at that time my size 12 jeans was getting tight. I'm usually a size 11. 10 is too small, 12 is too big. But when I got to the point that 12 was tight, I didn't buy a size 14. I said, Ronke, you're not going to size 14. And I just cut down, increased my output, and I'm back to my size 12, size 11 now. So that's what we need to do. We need to not go to the next step. It's so easy to just go to the next size up. State up to yourself, I can do this with the grace of God.
Okay, thank you. I can do this with the grace of God. You got to do it. God is not going to help you. You got to do it. That one, you have to work it. So, recordings, yes, we've recorded this session and we will be sharing it with you, everyone on call. Thank you so much. This is one of many life kits, life survival kits edition to come. We're just going to be discussing life issues, life topics. And if there are topics that's been coming to your mind and you want us to talk about it, get experts to come and enlighten us about this, please feel free to send us a message. On that note, I will be closing this event. It's been a pleasure being with you this evening. And I would just say, yeah, go girl, keep embracing menopause, enjoy. It is a transition and not a disease. Enjoy. Thank you so much. Thank you.
Thank you for having us. Bye.
Bye.
Bye.